So it's very crucial to diagnose it rightly before labeling somebody with polycystic ovarian syndrome. The word syndrome means collection or group of various symptoms and signs. And for the past decade or so, the awareness has very much increased. But I'm just going to highlight in this video about why do we think this trend is increasing, why PCOS happens in the first place, and what are the things that are associated with it which are important for us to know. So coming to the definition of PCOS, it's very important to know that it can be diagnosed even without a scan. So a doctor who knows how to diagnose PCOS can just do an examination, ask history, and based on that, PCOS can be diagnosed. There are three criteria, and any two of these three criteria, if they are positive, we can say that this lady is suffering from PCOS. So first one is irregular periods or infrequent periods or trouble with ovulation. The second one is signs of excess androgen or male hormone. And these can be acne or a lot of pimples and skin issues or oily skin. Excess hair growth. So unwanted hair growth at unwanted places, basically like under the chin or on the chest, and hair loss in terms of androgen type or male pattern baldness, basically. And the third is obviously the signs of multiple cysts or little follicles in ovaries on the scan. So let's have a little chat about why we think PCOS is on rise. Now, first factor is genetics, which is out of anybody's hands, but we have noticed over the last decade or so a big change in the environment. So air pollution, factors like xenoestrogens, which are the chemicals in plastics and soaps and even certain cosmetics, are largely responsible for hormonal imbalance in ladies. The third big change has been lifestyle, hasn't it? So poor diet, lack of exercise, and also increase in sedentary habits has actually created a massive increase in obesity. And obesity and PCOS are very closely linked. We think that actually insulin resistance in the first place could be partially responsible for increase in PCOS. So how does that work? Now we all know insulin hormone is produced from pancreas, and it actually controls someone's blood sugars by pushing the high blood sugar into the body cells where it can be utilized as energy. Now, imagine a person who has insulin resistance, which means that the insulin is present in their body, but it is unable to do its job or function properly due to the resistance of insulin. And this happens most of the times because of fat or excess fat in the body. So, insulin resistance can actually lead to increase in incidence of PCOS. The next big factor is stress. Now, stress could be physical or mental. And we all know that stress can actually cause inflammation in our body at micro level. Now imagine a person getting a cut or bruise or an injury and how the body reacts and causes inflammation or swelling around it to help it heal. But imagine somebody having this chronic or long-term stress in the body for various reasons, and this stress is not good. And that is one of the factors, not only for PCOS, but we often see it in other diseases such as diabetes or thyroid or even other hormonal imbalance disorders. So, why do we need to care about PCOS? Is it just about getting her periods right and helping her with fertility treatments? Absolutely not. PCOS is much more than that. It is linked with risk of endometrial cancer. The other one is obviously higher risk of prediabetes and diabetes. And even if this lady gets pregnant, remember she has a higher chance of getting something called as gestational diabetes or diabetes in pregnancy due to weight gain or skin problems or even excess hair growth. These patients could have problems with self-esteem, self-confidence, and also a lot of other psychological issues like anxiety, depression, much more common in PCOS patients. And again, remember, most of PCOS patients are actually obese. So it's like bringing all the package that comes with obesity. So these women are actually at higher risk of having obesity related problems like heart problems or stroke, or even sleep issues like obstructive sleep apnea. And this can affect the quality of life dramatically. So this video is just to highlight that PCOS or hormonal imbalance is not just about periods or fertility, but it's much more than that. In our next video, we are going to discuss about what we can actually do about all of these things and how this knowledge is helpful to us in prevention.